Okay, so one of the questions I get asked a lot is to explain basically what the different weight loss procedures are, and a little bit about them, the pros and cons, things like that. So just thought I'd put something together just so that I could go over that with everybody and just kind of let everybody know about the different procedures. So essentially there are four main procedures. There's the gastric band, there's the sleeve, and there is the gastric bypass and the duodenal switch. Okay, so those are the four main procedures that people have done for weight loss. They each have their pros and cons. As you go up from band up to switch, they each have the increase in their complexity levels. So we're just going to put this together. We're going to go over the four different procedures and, like I say, what they are, how they work, pros and cons, things like that. Okay, so let's get started with the first procedure. Okay, so let's talk about the gastric band. Okay, so the gastric band basically involves an inflatable band that's placed around the upper portion of your stomach. Okay, and that creates a small pouch just above the band, and then the rest of the stomach is below. Okay, everything stays intact. There's no surgery to change the structure. So the band separates a little pouch on top, and then the rest of the stomach is below. So how does it work? So due to the smaller pouch, basically you're only going to need to eat a small amount of food to satisfy hunger, and it will promote the feeling of being full. Okay. The size of the opening between the pouch and the remainder of the stomach will determine how full you feel. Okay, and then the size of the opening can be adjusted and is adjusted by filling the band with some sterile saline, which is injected through a port that is just underneath the skin. Okay. Now, what happens is they reduce the size of the opening gradually over time, and they're called adjustments or fills. Okay, they don't do it immediately because it's not an exact science. They kind of have to figure out how tight to make it. So they do it gradually over time. And it works, basically, the band works through a method of restriction. Okay, so we're going to talk about the different procedures and how they work. This one is based on restriction. Okay, it restricts how much food you can be eating per meal, and then restricting the emptying of food through the band. Okay, so it restricts how quickly the food can go through the band into the lower part of the stomach. Food is digested, absorbed as normal. So the idea basically is that you'll feel fuller with the food that's in the little pouch, and then it will gradually go down into the lower pouch, and it will be digested and absorbed as normal. So some of the pros: reduces the amount of food that a person can eat or can hold, less invasive than the other procedures, shorter hospital stay, usually requires less than 24 hours, has the lowest post-operative complication rate of all the other surgeries, lowest risk of deficiencies in vitamins and minerals because you're not changing the structure at all. Some of the downsides: you get slower weight loss than some of the other procedures. Okay, so the weight loss is slower and not as great. A higher percentage fail to get at least 50% of their excess weight off with the band. So slower and not as much weight loss. Normally, typically around sort of 50 to 70 pounds can be expected with a band. It requires a device being put into your body, and when you put a device in your body, you never quite know how your body's going to handle that. So, it can reject it, all kinds of things. And some of the things that can happen: the band can slip, the band can erode into the stomach, and that happens to patients. And I'm noticing more and more over time that seems to be happening more and more to patients that have had the band a few years ago. Less people do the band now because of some of the things that they're finding. You can have mechanical problems with the port, the tube, and that often happens with patients, or sometimes happens with patients as well. All right. So the band, really good procedure. It supplemented the bypass. It was kind of like, a bypass band and then sleeve, and so it gave an alternative. Like I say, less surgeons are doing these nowadays just because of some of the disadvantages of doing it. It is the least invasive procedure, so for a lot of people that's very appealing. It's reversible. You can take the band out if you don't like what it's doing or whatever. And that has its pros and cons. Because it's reversible, it's not a massive commitment, so sometimes it encourages people to have weight loss surgery. But also because it's not a permanent thing, you kind of, you're like half in, half out kind of thing, so sometimes that impacts sort of what people do as far as commitment level to it. So, you know, you're not quite fully committed to all the different changes you have to make because you know you've got an out. So that can be some of the downside. So it can be a positive and a negative. But that's the gastric band. And now we'll move on to the next procedure. So let's talk about the gastric sleeve, okay? So the gastric sleeve, this is probably the most common procedure that people pursuing when they come for their evaluations with me. Basically, let's talk about the sleeve. So what is the sleeve? The sleeve is performed by removing about 80%, approximately 80% of your stomach, okay, which leaves you with a pouch that's kind of like the shape of a banana, all right? And then how does it work? So basically, the new pouch will hold less food because it's smaller. You reduce by about 80%. So it holds less food, which restricts the amount of food you can eat, therefore restricts the amount of calories a person will eat. More significantly probably than any of that is the impact it has on the gut hormones, which control factors like hunger, feeling satisfied, and blood sugar. So, you know, when a person has a sleeve, typically they won't get the cravings, they won't feel as hungry, things like that. Now, I will add the caveat that I've read research that this can be not a long-lasting thing, and it can go away as soon as 6 months, although that's rare. It can last anything up to about 2 years. Sometimes it lasts longer, but it's not a totally permanent thing, but it does make those changes and give you kind of a platform to go by. So what are some of the pros? It restricts the amount of food, as we've said. It doesn't require any sort of foreign object like the band, which we just discussed. It doesn't require any foreign object, so there's no risk of your body rejecting the object that's being put in. It starts off a rapid and significant weight loss. It's not unusual for a patient to lose, you know, 5-6 pounds a week. And you consider that to the sort of pound a week that most people normally lose. That's very rapid and significant. Causes changes in the gut hormones, like we said. Earlier, reduces appetite, improves feeling satisfied, things like that. Some of the disadvantages: it can't be reversed, it's non-reversible, unlike the band. It has the potential for vitamin deficiencies, okay? So those vitamin deficiencies because your body is not absorbing the hormones as well as it would, the vitamins and things like that as well as it would normally do. So you can have some deficiencies and you might need to take supplements. And then there's also a high rate of complications over the gastric band. Obviously, it's a more invasive procedure, so as you increase the complexity, your complication risks increase, okay? So that's basically the gastric sleeve. Like I say, probably the most popular one I see within my practice of people who are having evaluations done for their surgeries, but that's the gastric sleeve. So we'll move on to the next one. Okay, so let's talk about the gastric bypass, and this is also known as the Roux-en-Y, and it's considered the gold standard of all the weight loss surgeries. Okay, so let's talk a little bit about how it works. It's a little complicated, so we'll go through it, and hopefully it kind of makes sense. So there's two components to the procedure. First, they create a small stomach pouch by dividing the top of the stomach from the rest of the stomach. Okay, and then the first portion of the small intestine is divided. And the bottom end of the divided small intestine is brought up and connected to the newly created small stomach pouch. Okay, the procedure is completed by connecting the top portion of the divided small intestines to the small intestine further down, so the stomach acids and the digestive enzymes from the bypass stomach, and the first portion of the small intestines will eventually mix with the food. Okay, so it's very complicated, but you know, essentially you're going to get a little pouch, and it's going to bypass. Everything's going to connect up at the bottom, and you're still going to get a lot of the stuff you need to process and digest the food. So the ways in which the gastric bypass works, and there are several ways. The newly created stomach pouch is considerably smaller and means smaller meals can be eaten, which obviously translates into less calories. And then also due to the changes, there is likely to be less absorption of calories, but also less absorption of nutrients. So you don't absorb calories as well, which is a good thing, but you don't absorb nutrients as well, which is not a good thing. Okay. And then probably most importantly, as well as rerouting the food stream, like the sleeve, is the impact it has on gut hormones, which we just talked about promote feeling satisfied, suppressing hunger, things like that. And it also reverses type 2 diabetes, which is often for a lot of people something that's very necessary because their diabetes is not being controlled effectively by traditional, typical methods. Let's see, some of the pros. So you get significant long-term weight loss. With the band, you're talking 50 to 70 pounds. Sleeve, you're talking maybe 70, 80 to 100, 120, that sort of range. And bypass, you're looking 120 plus. 200 can be lost. Depends on where you start, obviously, and how much you have to lose, but it's significant in the weight loss. Like we said, it produces the changes in the gut hormones, okay, which is obviously a positive, and it leaves a person feeling more full and satisfied after meals. All positives. What are some of the negatives? What are some of the drawbacks? It's more complex. So because it's more complex, obviously you might have greater complications. As they go up, they get more complex in surgeries. You get deficits in, long-term deficits in vitamin absorption and mineral deficiencies, so things like vitamin B12, iron, calcium, and folate, things like that. You're definitely going to need to take some supplements to supplement for the deficiencies there. It's going to require strict adherence to the dietary requirements that the nutritionist will give you, and like I said, you're going to be on supplements. You're going to be basically lifelong on supplements. And you also need to make sure you're compliant with all the follow-up stuff. Okay. As you get more complex in the surgery, you get better results, but you get more potential drawbacks. So it's a toss-up. You have to kind of weigh all that stuff up. But especially if you've got a really bad diabetes, this is a great surgery for that. Okay. So that's the gastric bypass, and now we'll finish off with our last one. Okay. Okay, so the last one we're going to talk about is the duodenal switch. The switch is the most complicated of all the weight loss procedures. Okay, essentially it combines your sleeve with the bypass. Okay, so the first thing they're going to do is they create a small banana-shaped stomach, just like they do with the sleeve, by removing a portion of the stomach, and then a large portion of the intestines is then bypassed, very similar to the bypass. Okay. Now, so how does it work? So the first portion of the small intestines is what they're going to take care of first, which is known as the duodenum, and that's divided just past the outlet of the stomach, okay, the opening of the stomach. A portion of the small intestines, which is typically the last portion, is then brought up and connected to the outlet of the newly created stomach, so that when a patient eats, the food goes through the newly created sleeve, the banana-shaped pouch, stomach pouch, and then directly into the segment of the small intestine. Okay, they roughly bypass about 3/4 of the small intestine with the food. Okay, so the food bypasses about 3/4 of the small intestine. Now, the bypass small intestine, which carries the bile and the enzymes and stuff like that breaks down the food, and the absorption of protein and fat and things like that, is reconnected to the last portion of the small intestine so that they can eventually mix with the food stream. Okay. And then similar to the other surgeries, this basically helps initially reduce the amount of food that's going to be consumed. Okay. However, over time, this impact lessens and patients are able to return to eating normal amounts of food. But because the food is not mixed with the bile and the enzymes until much further down in the small intestines, that's going to result in significant decrease in the body's ability to absorb calories, nutrients, and things like that. So again, like the bypass, great. Less calorie absorption, that's awesome for us. Less nutrient absorption, not so awesome for us. Okay, oftentimes, like with the bypass, you have to take supplements to address the deficiency. Finally, kind of similar to the gastric bypass and the sleeve, the surgery affects the gut hormones. Again, we've talked about that. Hunger, appetite, things like that get impacted. People feel more satisfied, blood sugar control, all of that kind of stuff. And then if your diabetes is so bad, okay, this is considered basically the most effective treatment for diabetes. Okay, so the sleeve will take care of diabetes if it's kind of not so bad, but you have it. The bypass will take care of it if it's like bad and it's being really hard to control. But if your diabetes is really, really bad, small percentage of people, this is the best, most effective way to deal with that. Okay. What are some of the pros? The most weight loss, you can lose the most weight with this than any of the other procedures. Allows normal meals, near normal meals eventually over time, which for a lot of people is a good thing. Reduces the absorption of fat by about 70% or more. So that's a good thing. Okay, so you're not going to absorb fat as well, about 70% of absorption. Okay. Changes the gut hormones, it reduces the appetite, all of that we've gone over and we've talked about. It's the most effective for surgery for diabetes. Some of the cons: highest complication rate. As we've noticed, we get up in complexity, complication rates, risk of complication rates increases. Longest hospital stay out of all of them. Again, complexity of surgery increases, your stay in the hospital is going to increase. Just like if you have a gallbladder surgery, you're going to have less complication risk and get out quicker than if you have open heart surgery, right? Because it's more complicated. Has the greatest cause for deficiencies in protein, long-term deficiencies in vitamins, things like that. So you're going to be on supplements. And the greatest complications following up from surgery, again, makes sense. More invasive surgery, more complication rates. So just to sort of recap, the band and the sleeve, restriction, that's what their main game is. Their main game is restriction. Bypass, switch, absorption, okay? So restriction, absorption. You've got to weigh up pros and cons. As you increase in complexity, results get better, but complications and risk factors also increase as well. So you've got to weigh it up. Talk to your surgeon, trust your surgeon, you pick them for a reason, consult with them, but ultimately the decision is yours. But you've got to weigh up what you're looking for, what you're looking to get out of it, permanency, not so permanent, you know, major, less major surgery, all of those things have got to go into it. Okay, so hopefully this has been helpful, and please subscribe, like the videos so you can stay up to date with stuff, and also in the comment section, if you have anything to say about this, would you like other videos for me to do, please put something in the comment section. Happy to do anything that's recommended. Just give us some ideas, anything that would be helpful. All right, thanks a lot.